Hello, everyone, and welcome to our live feed this evening. I am just waiting for things to start up and waiting for our guests to arrive. And Dr. Dylan is here, so I'm going to add Dr. Dylan. Dr. Dylan, if you could request to join the live feed, and Dr. Kim and Dr. Patel, if you guys are on, if you could just request to join. Okay. Sorry, everyone. Just give me a moment. There you are. Hi, how are you, Dr. Patel?
Good. How are you doing?
I'm doing wonderful. I am so excited to have you here.
Excited to be here.
Yep. And we're going to also be adding Dr. Abog and Dr. Cutler, DylanCutler. If you two can just request to join the live, and then I can add you in. There's Dr. Dylan. It just takes a minute for everything to load up. Welcome, everybody. Just give us a few minutes to get set up. Hello, Dr. Dylan. How are you?
I'm wonderful. How are you?
I'm doing great. We have one more to add to the crew here. Dr. Kim is coming on.
Wonderful. I'm so excited.
I'm so excited. Hi, Dr. Kim.
Hi, how are you?
Oh, wonderful. It is so great to see all of these lovely faces here this evening. Thank you for joining me.
Thanks for having me and all of us.
Yeah.
Absolutely. So I just wanted to let everybody know why we're here and then jump into a really big conversation. We have a lot to cover tonight. So welcome, everyone. My name is Ashley Levinson. I'm better known, not lone, but known online as PCOS Girl. I am a 22-year PCOS patient advocate and educator. We are here because February is Heart Month, and PCOS, unfortunately, women with PCOS are the largest at-risk group of women for cardiovascular disease. So I know it's not a pleasant thing to think about or to talk about, but the reason we're doing it is 80% of cardiovascular disease is preventable. So when we have the right tools and the right resources, we have prevention, which is why we have this lovely, amazing panel here with us this evening. I would like to first start by going around and letting each of them introduce themselves. Dr. Dylan, welcome. I would love you to tell everyone a little bit about yourself and your expertise and your background with PCOS.
Sure. Thank you so much for organizing this tonight. My background in PCOS is kind of twofold. I was diagnosed myself when I was 16. So that's a long time ago now, so I feel like a veteran as far as taking care of my own PCOS. And then I also obtained a PhD in obstetrics and gynecology, and my specialty was PCOS, specifically lifestyle-based changes. So I really need to emphasize that I practice what I preach. It's really important to me that if I'm telling folks this is how you can improve your health, that I'm also doing it too, because yes, I have PCOS, anxiety, depression, all the things we're probably going to touch on today. But yeah, so lifestyle is my passion, lifestyle-based medicine, and I'm excited to share what we all have experienced over our careers.
Awesome. Dr. Kim, I'm so excited. This is the first time that I'm doing a live with you or a big event with you. So I'm so thrilled that you joined us this evening. And I would love to learn a little bit more about you and your background and your experience with PCOS.
Oh, absolutely. Likewise, I'm excited to be here. I know we've just been corresponding by email and messaging, but here we are. So my name is Kim. I'm a naturopathic doctor based in Toronto, Ontario, Canada. I'm also a birth doula, and I call myself a reproductive wellness strategist because I do love supporting people in navigating their reproductive health journey from periods, fertility, preconception, pregnancy, postpartum, beyond. So, you know, all that shebang. Like Dr. Cutler, I am also here because I am a patient and a practitioner. So my practice, the heart of my practice is on implementing integrative medical therapies in managing reproductive health concerns, and I've made it a special focus of mine to see people with PCOS. So I actually don't know when I was first diagnosed with PCOS. It was more of like I actually didn't know there was a name to it. I think it's fairly new, or not new, but like there's a lot more recognition going on now, as maybe 10, 20 years ago that wasn't really the case. But I suspect I've had it for as long as 20 years now, right? So well, maybe a little under, but I'm a patient and a practitioner, so I see both sides of the discomforts and the pains of going through PCOS. So I'm here to share what I know, and to keep on advocating for not just myself, but for other people too. So I hope you learned something, and I'm happy to be here.
Thank you so, so much. And I'm going to touch on a couple of things that you said that I found kind of interesting and can kind of segue into what we're going to be talking about this evening. Dr. Patel, how are you?
Good. How are you doing? Thanks for having me.
No problem. I'm glad to see you. Happy to see you again. And you and I have worked together in the past, so I know how wonderful you are, but I would love you to tell everybody a little bit about yourself and your background and your experience with PCOS.
Yes, I think, similar to the stories that you guys have shared, my journey and story starts with because I have PCOS as well. And when I was diagnosed with it, I was told, just take birth control and you'll be fine. And then when you want to have kids, we can help you with other medications. And I am a pharmacist and I'm a board certified pharmacotherapy specialist, but despite all of that, I didn't even learn about PCOS through school, or, birth control and how it affects PCOS through school. So being a pharmacist, I myself took birth control for 7 years blindly, not knowing much about it. And I didn't, despite being on the birth control, I was still having symptoms. In, I think, about 2018, when I had gone through a lot of life changes, my symptoms were getting worse, hair loss, trouble losing weight, anxiety, seasonal depression, things like that. So since then, from that, I realized that, okay, these things are related to PCOS. It's not just a normal part of life. And then from that, I started to realize that, with lifestyle changes, I could manage my symptoms. And I realized that, there is a place for Western medicine, but sometimes it might not be enough. And for me, I wanted more than just, taking medications to cover up symptoms, but I wanted to try implementing lifestyle changes that could help, just like, what we're going to talk about today. And then from that, a lot of women reached out to me, especially in like the South Asian community, because subjects like PCOS, infertility, birth control, those are really a lot of taboo subjects. And I think people were excited to see that I was kind of, advocating and speaking out and really just sharing my story. And then that's when women decided to connect with me and were asking me for help. So that's how I started. I changed from, just being an advocate to more so helping women and becoming a coach and helping them with their PCOS.
And that's awesome. That's one of the greatest things. And I'm just going to put this little plug in real fast. That is the most empowering is when we all come together and we all share our voices. And one way you can do that, March 3rd, we have our annual PCOS Advocacy Day, where providers, patients, supporters, organizations all join together and we talk to Congress about prioritizing PCOS funding, research, education awareness. And you don't have to have any prior experience. You just have to have a willingness to share your story. And I can tell you, this is going to be my 6th year. It is one of the most empowering events that I have ever done. I mean, I'm normally a talker, but now you can't get me to shut up about PCOS. I'm constantly all over the place talking about it. And it was just finding that connection with other people. So we're here because it is the 9th annual Heart for PCOS. And as we already established, or I established, PCOS has a connection to metabolic health and cardiovascular health. So a lot of times when people talk about PCOS, as you mentioned, it's because they are in reproductive years, or they're having problems getting pregnant, or problems with their period. So the focus is usually on our reproductive system, and we forget that PCOS is endocrine, which means, yes, it affects your reproductive system, but it also affects you metabolically, hormonally, and psychologically. And when we ignore some of these other areas, we could be in danger in the long term. So I would like to start with Dr. Dylan. Why is paying attention to our metabolic health so important with PCOS?
Yeah, absolutely. I think you really touched on it in that there are a lot of different systems of the body that are involved in PCOS. And you could argue in most conditions, what all of us have in common as practitioners is that we are holistic practitioners. So we believe that all the systems of the body are connected, because they are. Like, looking at myself, they are connected. So by just looking at the ovaries, like, I have a doctor in OBGYN, but if you read through any of my content, you wouldn't really see that right away, because I'm talking about nutrition, I'm talking about physical activity, I'm talking about mindfulness, because all of these are connected, to our ovaries, but also to our heart health. And our blood flows throughout our body. So that's a really easy way of thinking about it. If our blood flow is, not as healthy as it could be, then it's going to affect multiple different organs.
Absolutely. Dr. Abog, would you like to add in on that and give your perspective on that as well?
Sure. Yeah. PCOS, as we all know now, it's a complex hormone and metabolic disorder. So I think it's a disservice if we just think about it as just an ovarian or a reproductive issue. There's a common understanding that, yes, PCOS is this thing that's driving ovulation to, not be non-existent because of presence of clinical signs and symptoms. But what often gets left behind the conversation is that, yes, there's core hormonal issues at play, but these things trickle down and affect body systems too. So I think, part of what we're doing now in being advocates for PCOS and other people is just shedding light on how we need to make that connection, that it's not just a fertility issue, it's a whole health issue. So what Dr. Dylan said was spot on. Yeah.
Yeah, absolutely. What about you, Dr. Patel? Would you like to add in on that as well?
I think just one more thing to add is that, remembering that PCOS is a lifelong condition. It's not something you will face challenges with if you face challenges during your reproductive years, or, during, trying to conceive, but remembering that it's a lifelong condition. So, later in life, even after you're done having kids, heart disease is still going to be something that, you should be concerned with, which we'll definitely talk more about, I'm sure.
Yeah, absolutely. And thank you for saying that it is lifelong, because with PCOS and with heart disease, what a lot of people don't realize is, because we're dealing with risk factors, which we're going to get into in just a second, that we can start developing consequences as young as in our teens and our 20s due to some of these risk factors. So I would like to kind of go around again, and again, Dr. Dylan, I'm going to start with you. What are some of these risk factors that we should be looking out for, and how young should we start thinking about this stuff with our heart and PCOS?
Yeah, so as far as how young, I think, as anyone listening can start paying attention. The wonderful thing about all the changes that we're going to talk about today, they actually can impact our general well-being in general, for the average person and anyone with PCOS. So it's not like you're hurting yourself to start paying attention to your heart health. As far as things to look for, I'll touch on a few and let the rest of the panel discuss. I'll start with, diabetes or prediabetes, and that might look like insulin resistance, hyperinsulinemia. So knowing your blood sugars and your insulin levels, as well as your, there's going to be other blood work that we'll talk about later on, but that's what I'll start with.
Dr. Abog?
I think that, yeah, that's a really good start. I don't think there's necessarily like a hard line as to when to start looking out for, or at least like just thinking about health in general. What I place importance in is being able to educate people on what normal looks like. I mean, I'll get into that later, but in terms of like risk factors, yes, diabetes is one of them. But I also, you know, what ultimately drives PCOS and its associated complications in heart health is inflammation. So being able to understand, being able to even just rule out markers of inflammation, seeing where, you know, where the body is suffering, like, is it a thyroid issue? Is it a blood sugar regulation issue? Is it like a stress hormone issue? So all those things that could drive inflammation is just as important to underscore as you know, not just the PCOS part of things, but yeah. So I'll let Dr. Patel take over. We have so much more to say about this, it seems. Right.
Dr. Patel?
Yeah, I think also in addition to what you guys said is, you know, just being mindful of your family history, because that can also have an impact on your overall health with PCOS or general well-being, like things like knowing, you know, if your family has a history of diabetes, or knowing, you know, if your family has a history of high cholesterol levels, so that, you know, when you do go to, even if it's just like an annual visit to the doctor and you get annual lab work done, you know, you'll start seeing, you know, like your blood pressure and your lipid panel, you may start noticing or being more mindful, like, you know, these are my levels, and I know I have a family history of high blood pressure or high cholesterol or low HDL. So these are things that, you know, just being more aware so you could be more on top of it.
Okay, so I want to step back a little bit with this and talk a little bit more about PCOS. What are things that we should really pay attention to as far as weight or feeling fatigued or having excess facial hair? I mean, are there things that we should pay attention to that tell us that our bodies might be off and we need to kind of readdress or work with a provider like one of you to kind of address and figure out what's going on? We're going to go around again. Dr. Dylan, I'm going to start with you.
Yeah, that's a great question. And I will start with the periods. We want to be having regular periods, and we don't want them to be super heavy or super painful. They're not supposed to be painful as much as we've been told, that we're just supposed to suck up the pain. But they, you know, it might be uncomfortable, but not painful, and the amount is important too. So we want to be having regular periods, and you know, there are pharmaceutical interventions that can help with that. There's also lifestyle interventions, and some people need both. Some people choose one or the other. So that's definitely something to talk to your physician about.
Awesome. Dr. Abog?
I think doing like a head to toe check like now and then, right? So seeing if you're prone to headaches or migraines, if you're like you said, like that, those very physical changes like weight gain, like if you feel you know, you're easily gaining weight or easily losing weight for that matter, like things like that are good to keep in mind. I also like to you know, do a quick screen on your heart health. So if things like palpitations, like maybe if you feel like your blood pressure is changing, sometimes that can be a symptom on its own. Digestive issues are also things that I look out for, because digestive inflammation can also be a good indication for someone's state of health and how PCOS is progressing, and many other symptoms that if you know, anything that makes you think that you are not your best or you're not 100% at your best health, I think that's a good starting point at any given time.
Dr. Patel?
Yeah, I think, you know, like we've been talking about the holistic approach, thinking about all the symptoms from head to toe. And also, I think, you know, I don't know how it is in Toronto, but I know in like the United States, I think sometimes when, you know, women express these concerns, they might just get ignored and say like, oh, this is not related to PCOS, or, you know, it's just stress. That sometimes also something gets told, but if you yourself feel that, that's not correct, or you feel that deep down something is wrong, then, trying to find another practitioner that will listen and help you.
Right. Absolutely. So here's a question, and any one of you can jump in on this. So why is lifestyle so important? Why do I have to worry about what I eat or how I move or reducing stress? I mean, what's that going to do to help my PCOS? Anyone can jump in.
I can start.
Okay, go for it.
Oh, okay. So ultimately, PCOS is again, like this complex chronic hormone metabolic issue. And if you think about it, like hormone and metabolic issues are driven by what our routine is, what our lifestyle is. So, it's not too far from reality that lifestyle changes, lifestyle management is going to be a key step in overcoming PCOS symptoms and, how it affects our health. So I think that's why it's important to emphasize that it's very powerful.
Absolutely. And Dr. Dylan, you do a lot with nutrition as well. So why is this stuff so important?
Sorry, it cut out a bit, but I was going to add that we are going to be eating every day anyways. So when I first started focusing on nutrition, I thought, well, I might as well, make use of this food that I'm eating, the time I'm taking to cook. I might as well make it the best that it could be for me, and because I have to eat anyways. So that's one way of looking at it is, you're already putting this time in, the effort in. Why not make it, the most nourishing for your body? And the same with with movement. We all feel better, most of us, after we've been moving, whether it's, going for a walk or dancing. So many people love dancing, and that's movement. So there's a lot of ways that we can incorporate lifestyle changes seamlessly and have, fun with them. And it doesn't have to be like a prescription, basically. It doesn't have to be like a stressful prescription.
Absolutely. And that's why I've actually I've gotten away from using, first of all, the word diet, because what I say to everyone is diet, the root of the word diet means to nurture your body's nutrition and giving our bodies the right type of food and nutrition. And I've gotten away from, instead of saying exercise, I say movement, because when you say exercise, a lot of time you think that you have to be on a treadmill for 3 hours, or you have to take a 10-mile hike. And sometimes it is simply, like you said, just getting up and dancing and moving, just doing something to get your body in motion. So Dr. Patel, with lifestyle, can medications and things like supplements also be part of that?
Great question. It can be, and I think sometimes medications and supplements can help you. Sometimes lifestyle may not be enough to see effects right away. For example, like vitamin D, right? Like you could be going out for a walk every single day, and you may not be able to go during peak sun time, right? Like if you're working during the day, because of how our lifestyles are, going to school, working indoors, we may not be exposed to sun, or depending on where we live, we may not be exposed to sun. So for that, like you may be, going for walks, you may be eating foods that are fortified with vitamin D, but your vitamin D level may still be low. And if that's okay, you can supplement with it, and it's okay to do that.
Awesome. So I'm going to put all of you on the spot just a little bit. I'm probably going to pay for this later, but I would love to know, because you can look at things from two different perspectives. What are some of your favorite tips for yourself? And with saying this, let me preface this, everybody who's listening, that what is good for one person isn't good for all. So anything that anybody says is not a recommendation that this is something that you should do. Everybody needs to do their blood work, to have their health screenings with a provider that understands PCOS before you start any type of treatment or regimen. Okay, I'm off my soapbox. So, Dr. Dylan, what are some of your favorite tips for yourself? What would you advise yourself?
Yeah. Oh, there are so many things, but something that I don't think we talk about enough about, so I'll go there because I like to go there, is having a sense of purpose and meaning in my life, and that has been shown to decrease risk of heart failure and cardiovascular disease. So, having things that you enjoy. We've probably all been in a job that we hated, and it just like sucked the life out of us. Well, that affects our health as well. So, yeah, it's easier said than done to find, what is your purpose but it doesn't have to be a humongous, life purpose. It could just be an intention for a day and you could start there, or an intention for an hour and so on. So yeah, that's really important. And it does affect our heart health.
Awesome. Dr. Abog?
I think I'm going to chime in on that. That's a great one. Gratitude, I think, is also something I would, I practice, I try to practice, and I also recommend to everyone, not just people with PCOS. It helps to take your mind off of the stress of not just health issues, but daily life. There's a lot of studies on gratitude, but I I don't care about that. It's more for you, right? Like it's more being aware of what good things are going on. So in line with that, I also recommend that we try to practice self-compassion as much as possible too, just because living with PCOS, that comes not just with maybe silent health issues, but also physical changes that can change our view on ourselves, our self-esteem, our confidence. So whatever activities, physical acts, or even small acts that can hone that self-compassion is something that I would highly recommend as being part of your lifestyle tune-up. I think part of this too, also reflecting on what you consume in your lifestyle, physically, mentally, emotionally. So all those things matter. And it's just a matter of tailoring what those are for you. So yeah,
That's awesome.
those are my tips.
I love it. I love it. Dr. Patel.
I love the tips you guys shared. I think, going along with that, like, I feel like as women or, women with PCOS, people with PCOS, we can be very intuitive if we listen to our bodies and what our bodies are telling us, and that goes along with what you were saying, like, headaches, gut health, like that's our body telling us something, and just listening to that and being aware of that. And, kind of like what we were talking about, what works for one person doesn't work for everyone. So listening to your own body. And one tip that I try to incorporate throughout my day is something called box breathing. It's just a breathing exercise that's really simple to incorporate. For anyone that doesn't know, it's basically you just take like 4 breaths in and 4 breaths out. And it's basically kind of like a box. So you do it in like a cycle of 4s. But I try to do that kind of like right before this live, kind of like refocus and, bring down the stress levels, in between activities, or like, going from work to coming home, just sitting in the car for a few minutes, doing the exercise, kind of just refocuses and brings the stress level down.
Right. And one thing that I do love is the central theme that all of you are talking about, because it's something we do not talk about enough with PCOS, is mood and how mood can affect our stress, our hormones. 45% of patients with PCOS have anxiety, 34% have depression, eating disorders, sleeping disorders, and nobody really talks about it. And if we're talking about this in the context of heart health, hello sleep, hello not eating right, hello stress levels, I mean, that impacts everything, right? So let's talk a little bit more about this. Why is reducing stress or looking at things that cause stress so important? Dr. Dylan, I'll start with you.
Yeah, it's really important. And I think we are, talking more and more about mood, especially some mood disorders more than others. There's others that are still kind of lagging behind. But as far as anxiety, depression, we're talking about that more. And one thing that seems to, across the board with PCOS, our cortisol is really important to pay attention to. And so cortisol is the stress hormone. The problem with it when it's chronically elevated also can contribute to our elevated cholesterol levels, triglycerides, blood pressure. So that's the connection to the heart right there, as well as our mood disorders. And then, of course, we know if we're stressed, it's probably impacting our sleep. And once our sleep is thrown off, everything's thrown off, in my opinion. So cortisol is a huge one, and there's a lot of things we can do, like the box breathing is a great example. I meditate personally, going for a walk. Like, I think adding self-care into our day to decrease stress is huge, and that's, I think the number one thing that I think everyone on the planet could use, but I'm going to say specifically PCOS, we need to add, start with 5 to 10 minutes. That's literally, it's about reducing your stress, and go from there.
Awesome. Dr. Abog?
So lifestyle and diet, diet and lifestyle management strategies for PCOS are not, they don't just affect you subjectively. Like, obviously, like when you're implementing these new habits, like you obviously feel great, like you feel it right away. But there's another upside to doing this, and it's the changes in objective markers. So a lot of these these lifestyle management therapies, like movement or weight training or balancing your meals, they all have objective, they have significant changes to objective markers related to PCOS, related to inflammation. These can have significant improvements in insulin, in mitigating insulin resistance that you see in diabetes and heart health complications. You see changes in cortisol levels, so your stress hormones, and its impact on how your ovarian hormones like testosterone, estrogen, progesterone, they all have an impact in not just how you feel subjectively, but also the objective part of your health. So there's a lot of power in routine therapies even.
Awesome. Dr. Patel?
Yeah, I think you guys covered all the main points, but I think that, unfortunately in our society, it's acceptable to, not get enough sleep or pull all-nighters or, work 80 hours a week. And unfortunately, we live in a society now where those things are acceptable. And so I think, we have to take a step back and realize that we're not supposed to function like that, and things that may cause stress, we don't know. Being mindful of the products you use on your body, those can also be stressful to your body if they have toxins in them. Overly processed foods, things like that are also another form of stress that we may not be aware of. But, realizing or trying to take a step back from your lifestyle and, say, like, are these habits stress inducing or stress relieving? Like, always rushing to work or waking up late, and then that's just like putting your body in a stress response, and that's not good long term either.
Right. So we know that there are all of these different factors that can impact us, and we were talking about prevention. So what are things that we should be doing as far as like screenings, as far as, is there certain blood work? Is there certain things that a doctor should be checking, such as family history, the symptoms we're having? So if we could just go around and talk a little bit more about this. And Dr. Abog, I'm going to actually start with you this time and ask you, what are screenings? How often should we do them? What are we looking for?
I think it helps to have a baseline screening regardless of where you are in your health. So if you're sick, obviously that's a good place to start. But if you feel like you're at your best, even, like, that could still tell you that, okay, hey, these might be my optimal levels, right? So it's still good feedback regardless. Besides like the hormone panel of, I often test for things like cortisol, obviously the PCOS core hormone tests like testosterone, DHEAS, I'm not going to attempt to spell that out, estrogen, progesterone, thyroid markers. I also look at that just because your thyroid health also has an impact on things like blood sugar regulation. That being said, your metabolic markers are also important to screen for: insulin, blood sugar, hemoglobin A1C, vitamin D, and I feel like I'm going to cover so many things. I'll pass the torch back to other people. Sorry. I can go on with this.
No, it's okay.
You're fine. Dr. Patel, you want to
Yeah.
continue on with a couple other things we should be looking for in screening?
Yeah, I think like in addition to what she mentioned, like a lipid panel, which looks at like the LDL, triglycerides, total cholesterol, and HDL, which is actually, you know, the higher it is, the more protective it is of your heart. So those are important labs to at least get checked once per year at a minimum. And then, you know, if it's feasible for you, you can do it more often, like twice a year, but at least at a minimum, try to aim for a year if you can, if you have, you know, the access to health to do that, or healthcare system to do that. And then, you know, checking like blood pressure, those are things that impact the health, or your heart, sorry, your heart and your health. But yeah, those are some of the screening things to look for.
Awesome. Dr. Dylan, any more recommendations?
Yeah, I'll second, you know, blood pressure is really key. And I think that that is one that a lot of PCOS providers may not be aware of. It's not in a general workup for PCOS. And if we're talking about heart health, then it needs to be. So definitely that's something that unfortunately as fighters, we have to, you know for ourselves that we have to get our blood pressure checked. And then inflammatory markers like C-reactive protein. That's, you know, a lot of women do have, or people with PCOS have higher levels of CRP. And that would point to a lot of the symptoms that we're dealing with. And then it also might increase our risk of heart disease later.
Right. Okay, so we know we have all of these factors and all of these things that we can screen for, and we try to be as vigilant as we can be. And for some of us, we get to a point where we start realizing, uh-oh, I have hypertension. Uh-oh, I have high cholesterol. My insulin resistant has now made me either pre-diabetic or diabetic. Now what? When we get to that point, are there ways that we can reverse it or make it better, or things that we can do to kind of help our heart health in the future when we get to that point? Is it a point of no return, or do we have options is basically what I'm asking. So Dr. Patel, I'm going to start with you.
It's not a point of no return. There are options, you know, and you may be, you know, talking a little bit about medications, you know, you may be started on some medication while you're making lifestyle changes, which is totally fine. And, you know, like the questions to ask the provider is, you know, how long do I have to be on these medications? Do I have to be on them for life? Or is there an endpoint? Like, you know, if I want to implement lifestyle changes for the next 6 months while being on these medications, is that okay? And then afterwards, if I want to come off, is that something that's an option for me? So asking those types of questions while you make the lifestyle changes. And
Awesome.
yes, that's all.
No, you're fine. You're good. Dr. Dylan?
Yeah, I feel like we're all going to say yes, there's definitely chance because that's what we do. If we want to get into specifics, you know, our nutrition is huge. What we put in our bodies becomes us. So we're going to see big changes. Things like increasing our fiber intake could benefit all of the issues that you had mentioned. Decreasing saturated fats are really important for heart disease prevention. So they're found in a lot of animal products. So we want to look or focus more on unsaturated fats, things like avocados, nuts, seeds, olive oil. Those are healthier fats. And sodium. Sodium is in a lot of processed foods. And so that's something to be aware of if we're, well, for everyone, but especially, you know, if we are eating a lot of processed foods, then if we try to, you know, eat more whole foods, you know, fruits, vegetables, whole grains, food from the ground, it will slowly push out the processed foods. And that's kind of my philosophy.
Yeah, I love it. Yeah, there has been a lot of research, and I'm seeing a lot of nutritionists and dietitians starting to incorporate the fiber, which is fantastic. I love it. But I have a question for you. I want to keep it here for 1 second, because one thing that I have seen in research, and I know not everyone is going to agree, and it's not for everyone, but I've heard that incorporating more of a plant-based diet is actually really good for your heart. Can you speak a little bit about that?
Absolutely, yeah. So I am plant-based, and that is one of the number one reasons I am, as well for preventing type 2 diabetes and able to reverse insulin resistance even with plant-based. So the key is, again, if we're eating a whole food plant-based diet, we're likely going to be eating a lot of fruits, a lot of vegetables, a lot of whole grains, which all are packed with antioxidants, vitamins, minerals, and pushing out those processed foods. The other way that we're kind of attacking the insulin resistance there is by limiting our animal products. We're limiting our saturated fats. So that is, key if we're talking about heart health and heart disease. So I'm a huge fan of plant-based eating, and it doesn't have to be 100%. I'm a vegan, so I'm 100%, but it doesn't have to be. Even changes like swapping one dinner animal protein for a plant protein can help reduce our cholesterol, for example. So yeah, there's always a place to start.
I love that. Dr. Abog.
Yeah, I've seen that research too, and it's really it's great. It's really cool to see that, oh, this is what we've been suspecting all along, right? Like having that balanced meal specifically loaded with fiber is going to take you a long way. I mean, I for one personally I'm not 100% plant-based, but I do have a good portion of it in my daily meals. And I think with nutrition science, it's very complex, and sometimes the way we communicate it to other people, like it may not be implemented as optimally as we'd like it to be. So I think managing expectations, and this goes to, this also hopefully answers your question previously in terms of how do we manage this myriad of lab findings. And there's obviously a lot of options that you have, but it's just more so being able to lay out expectations and how we can achieve them step by step. And of course, nutrition is going to be part of the things that will help to improve our health. Yeah, I think I forgot the question.
No, you're good. You're good. You were totally right in the park there. It was awesome.
Yeah.
So I want to go back to, we talked a little bit about PCOS being lifelong. I'm someone who had a hysterectomy, and, my doctor basically told me, you have a hysterectomy, you're fine, you don't have PCOS anymore, which we know is not true. And now I am an older woman, and my doctor doesn't feel like they need to pay that much attention to my PCOS and how it can affect me because I'm in menopause now. So why do we have to change this perception, and especially for women with PCOS when they're going through perimenopause, menopause? I would love your feedback on this. Dr. Dylan?
Yeah, you raise a great point again, in that it comes back to how we are still thinking of PCOS as an ovarian condition or as a fertility issue. And then once you're past, wanting to have children, then guess you're okay. But I think that we've discussed enough today to realize that that's not the case. There are many other systems of the body that are still going to be affected. And especially as we age, there are, our health does deteriorate naturally. So it becomes even more important to incorporate lifestyle changes. And of course, the earlier you start, the easier it will be down the road, because it does take a lot of effort and time to incorporate lifestyle changes. So that's why I would say if we start young, then it will be a lot easier if we do come across problems later in our health, regardless. So yeah, it definitely, the narrative needs to change, and I know that there's a lot of people with PCOS that will benefit from knowing that your story and how much you share about that, because it's a really common story, unfortunately.
Absolutely. Dr. Abog?
Yeah, I 100% resonate with that. Also, again, like it all goes back to PCOS being a hormone and metabolic disorder. So the hormones that are, first and foremost dysregulated from the very beginning, it's still going to be there regardless of presence of your a uterus or not, right? Regardless of your fertility goals. So it's still going to be there. It's still going to affect your, the insulin levels, for instance, and testosterone levels. It's still going to impact your blood vessels, your heart muscles, and your thyroid. So all these things are going to carry forward. So we shouldn't really stop talking about it, regardless of how young at heart we are, right? So it's always important to address that, and especially more so with addressing it with lifestyle changes.
Absolutely. Dr. Patel?
Yeah, I think, in addition to what they said, I think also, like, regardless of having that hysterectomy, like, it still affects, PCOS still affects your heart, it still affects your mental health, and all of those things are still important and need to be addressed. And going back to what I was saying earlier, if you feel like your provider is just writing you off and saying, like, well, you're just older now, or it's just stress, or, you're fine because you already had a hysterectomy, or, oh, you don't look like someone that has PCOS, then, try to find another provider.
Absolutely. So a lot of patients tell me they have a hard time talking with their providers, opening up, number one, because it's a very intimate conversation to have about all of these different things that are going on with your body. Another thing is, a lot of patients with PCOS feel when they do talk that they're just dismissed. They're told, just lose weight, just take a pill, just come back to see me when you want to get pregnant. So they feel like they're not being heard. So as the three of you are patients and providers, do you have any tips on ways we can better communicate with our providers to get the best care that we possibly can for ourselves? Dr. Patel, I'm going to start with you.
That's a great question. I think that when, as a patient, I feel like you want to ask your questions in a way that doesn't offend the provider. You don't say, like, oh, well, I looked on Google, or I saw on social media that, XYZ, but, say that, I'm curious because I have these symptoms, and, I read that it could be PCOS and it could be related. What is your experience with this, or what are your thoughts? Having that sort of open conversation, as opposed to, like, because I feel like a lot of it could be, the dismissiveness could be, if they get offended, or they feel like you're, acting like you may know more, even though you're really just sticking up for yourself. But, saying it in a way that, you want their input, and, saying that, I have these symptoms and I really feel like something is not right, despite, maybe what my labs are showing. I really feel like I would appreciate it if you could, consider doing further testing, kind of like a more, open type of conversation.
Absolutely. Dr. Abog?
It's a great way to see it, right? It can be very intimidating to talk to your medical provider sometimes when it comes to these, advocating for yourself. And it's unfortunate that we kind of have to walk on eggshells all the time. But I think that's a great point in making the conversation almost open-ended. And the way I like to word it as a patient is, I open with curiosity. Like, I ask my doctor, like, what do you think of this? Like, what are you expecting to see, right? Like, kind of knowing, okay, what is their train of thought in prescribing certain things? And then, you can make the suggestion, well, I found this study, or I found this research or this article. I'm curious to know, like, how this would complement this or that, so it's like, you're letting them chime in on your management plan. So without offending them, and without without that possibility of them dismissing you, right? So I hope that's a helpful way to look at it, just asking them what their expectations are, and how you would expect to feel them as a symptom, or any changes in your health and development. So
Absolutely. Dr. Dylan, any further tips
I
you want
love
to
all
add?
those. Yeah, I love all those. I'll take just a different direction, I guess, and talk about how people that are supporting folks with PCOS can do their part. Um, for example, a lot of the shame and stigma has to do with fat phobia in medicine. And we know that weight is a symptom and an issue with PCOS, and a lot of people are told that if they lose weight, then their PCOS will resolve itself, and that is the one solution. And unfortunately, that's not the case. It's also very shaming to say that to someone, so it prevents people from going back to the doctor. So, as someone in a smaller body, something that I do is I say I don't want to get weighed at the doctor, and that starts to create this ripple effect, hopefully, and normalize that weight. There are so many more factors to our health than the number on the scale. That's just one, and we know BMI is flawed as well. So there's things that we can do. There's people in our lives. Maybe as PCOS fighters, we can ask people in our lives to be there to support us. Even going to the doctor with us. Although I think in COVID that has been gone down as far as like we don't have that support there anymore. But even on the phone, if it's a telehealth, someone's sitting there with you on the phone and they can listen and be like you got this, like keep going, or like just in case you start to feel like you're like gaslighting yourself or something. It's just really important to have a friend there.
Yeah. It's really interesting that you said that about asking not to be weighed, because there's actually a whole movement, and can't remember where I saw them, but I'm going to find them and repost it. But they actually have cards now that you can download and print and take to your doctor. So if you don't feel like having that conversation, if you feel that it's going to be too confrontational, all you have to do is hand them the card that says, I do not want to be weighed today unless it's medically necessary, which I think is awesome, because I mean, I have a big mouth, so I have no problem telling people I don't want to be weighed. But for somebody else where, going to a doctor is a little more intimidating, having like a card and just hand them the card and say, I just don't want to be weighed today. So since we're on this topic, let's talk about HAES, health at every size, because we talked about PCOS is very weight focused for a lot of providers. But we're now starting to push more of a narrative that it's more about getting healthy, and that doesn't always mean the numbers on the scale. So I would love input from all of you. Dr. Abog, I'm going to start with you about health at every size and why that should be a consideration.
As you said, right, like it's not all about the weight, it's not the number on the scale. And this is for, I guess, another maybe a potential topic, but BMI, the basis of using BMI is highly flawed. Like it's not even based on actual medicine. It's an arbitrary number. It's an arbitrary index. So it's it's of course subjectively can be very it's misused, right? Like it's not used properly in the health scenario. And I like to use other parameters when it comes to assessing someone's health. I heavily rely on what people's experiences of themselves are. So doing that health head to toe check is a good one, right? Like if you feel like there's something off with any of your body systems, then that's one indication that maybe there's some room to improve your health there. But if someone's perfectly fine, like they feel great, they feel comfortable with their current state of health, then there's no need it's nothing to be fixed. But if someone wants to look further or deeper, I love labs for this. And that's why it's good to have a comprehensive check, not just looking at testosterone markers or PCOS markers, but also thyroid markers, cholesterol, inflammation, thyroid. All those things will give you a better indication of how someone's metabolism is running at this point, at that point of time, and that can give you more direction on how to best optimize someone's health. So it's really beyond the scale. I hardly use the scale in my practice, and that's worked out perfectly, right? Everyone feels comfortable, and we're actually getting some improvement. So I'd love to hear everyone else's take.
Right. Dr. Patel?
I think, just the education that needs to be done on the fact that weight gain doesn't cause PCOS. It's PCOS that leads to weight gain, which is a symptom which not everyone has. And, like you said, health at every size. Some people may not have weight gain as a symptom, and then they get dismissed like, oh, well, you don't look like you have PCOS, so I don't need to do, further workup. But that, aware or the advocacy and the education needs to be there that the weight isn't linked with PCOS. And
Absolutely.
I think, another measurement is like inches, things like that can also be something that's, beneficial for someone that may want to look at a way of tracking improvements in their body, or, like non-scale victories, like, are your clothes fitting better, things
Right.
like that.
Yeah, I love, absolutely love that. How about you, Dr. Dylan? Any further comments you'd like to add to that?
Yeah, I think a lot of really great points are made. I think another aspect is that, that a lot of people do feel they want to lose weight, and they come forward and say, I want to lose weight. And I think the question we have to ask ourselves is why, and where is that coming from? Is it that we think we'll be healthier, but maybe our blood sugar levels, or, our health is doing really well? Or is it that we think we'll be happier, or, get a partner, or like all these things that we think our society tells us that our weight is affecting? I think that is a good place, question. And then we can see if that is the right goal for the individual, or if that has kind of been pushed on them, or, absorbed by the society around us that is, extremely weight focused. It's hard to go a day without seeing a weight loss ad, or hearing a friend talking about it, or a parent. So it's kind of insidious, and that's why I think we're always fighting diet culture and always trying to figure out, like, what do I want outside of all these norms.
Awesome. So we're getting close to 8 o'clock, and I want to ask each of you one final thing. If you could give one phrase or one word of advice to the people that are listening, what might that be? Let's start with Dr. Patel.
I think one word of advice, patience, I think is a big thing to keep in mind. I know sometimes when we, go to these visits and we get these labs, we're really enthusiastic and we want to make changes overnight, but, with lifestyle, the key is really patience. Like we've been saying, PCOS is a lifelong condition, and the changes that you make, you want to make sure that it's sustainable and something that you can maintain. So patience is really the key.
I love that. Dr. Abog?
This is one word, self-compassion. I think I said it before.
That was my word.
We'll make it one word. That is one word.
That's, I think, at the heart of it, right? Like, we need to be more, I guess another word is forgiveness, maybe. Yeah. Maybe you can explain that better, but forgiveness and self-compassion is key when it comes to managing this, because again, like, the key to making these changes sustainable is to be forgiving of yourself, of your journey, right? Like, not all of this is going to happen all in one shot. Like, you have to give yourself the grace to try out these things, being open to support, and actually having that patience to see how things change for you. So that's my word.
Absolutely. How about you, Dr. Dylan?
Awesome. I believe you said phrase. So I'm going to go with a phrase because it won't fit into a word. You don't have to do it alone. So a support network is crucial, and it goes beyond, of course, healthcare providers, but even our friends and family, other people with PCOS. I remember when I was first diagnosed, I didn't know anyone with PCOS. It felt very isolating. That was before social media. There was no hashtags to go through and, see like, hey, someone else is dealing with what I'm dealing with. And I see Tatiana's in the comments. She's my PCOS, fighter, best friend, go-to. We talk about, all our struggles. And I think that it's really important to have, and a lot of my friends now also have PCOS, because I have built this, I've built it that way, people that understand me, that get me. And and then there's also a high population of people. But I think, you know, there's something about, you know, it's the same with mental health. When someone gets your anxiety or they get the depression, it's a lot different than a provider being like, that's depression, and this is what the textbook says about it. So, yeah, I think that the support network is huge.
It is. And, you know, I want to dovetail off that for a minute because I've known some of my fellow community members who are really friends, and I'll even go as far as saying family to me at this point, that I've known for 20 years. And some of these people I've never met face to face, but they are such an integral part of my life and my care. And you're right, it's because it's finding people that get it, that get you, that understand you. And that's also another big reason that I not only became part of this community, but also became part of PCOS Challenge, which is the National Polycystic Ovary Syndrome Association, because they get it. You know, their executive director, Sasha, has PCOS. Her husband, William, also helps run the organization. And they've built this platform that gives all of us a network, a voice, you know, a way to connect. And that's really vital in your care. So yes, you are not alone. As everyone said, remember to thank yourself and thank your body once in a while, because it's fighting with you every single day with PCOS. Make sure to keep your hearts healthy. Keep checking with all of these lovely ladies for tips. And before I go, each of you, if you could tell everybody how to find you, because we unpacked a lot, but I feel like we could talk for 2 or 3 more hours. So I want people to be able to get in touch with you to get more information. So Dr. Dylan, if you could please tell people how to get in touch with you.
Sure. So my Instagram is dr.DylanCutler. That's where I hang out the most. I also have a blog, Fruitful Dish with a PH, and I share lots of recipes, all plant-based, as well as just lifestyle tips. So feel free to message me. And I'm very friendly, or I think I am. So.
You are, Dr. Abog.
I'm also here on Instagram, Kim Abog ND. Though not always posting, I have to be better at this, but I'm a message away. You can also reach me by email or my website. It's just my name, kimabog.com. And yeah, I'm looking forward to supporting you, even if it's just online. I'm happy to be a part of your healing journey, and know that there's so many people, there's so many advocacy groups out there that are rooting for you. Yeah.
Awesome. Dr. Patel?
You can find me on Instagram at pcos.holistic.coach, or my website is www.pcosholisticcoach.com. And I'm also on YouTube. I have free educational information there, and my DMs are open as well. I would love to connect with anyone, you know, even if you just want to vent about the life of having PCOS, you know, we're all here for that too.
Right. And everyone, all of their contacts are also up on my page under all of the posts that I put up for the chat that we have this evening. I cannot thank all of you enough for this amazing hour, for your voices, for your friendship, for your expertise. What else can I say? It's just for everything. You guys are just awesome and amazing, and I am in awe of all of you, and so grateful for your time this evening. And hopefully we can do this all again in the future. But for now, I'm going to remorsefully say goodbye to all of you, and we'll see you again very soon. Thank you, and thank you everyone for joining us this evening and listening to our live. Have a great night.
Thank you.
Thank you.
Thanks for having us.